You may. Okay, I have no idea who to go to next. I could start at the top of the page. Everyone would like to weigh in, and everyone's access is a yes answer. They're in favor. There are some on another page that some are no, and I don't know if they're in the room or not. So I will, I'll try to alternate. Would that be a fair way to do it, folks?
I have a request, Mr. Chairman. There's a Dr. Krell from out of town who needs to get back to town.
Okay.
And if he could move to the front of the line, I would appreciate it.
Dr. Krell can move to the front of the line. Thank you, Senator Schmidt. Is Dr. Krell? Thank you, Dr. Krell, for coming forward. Please state your name for the record and where you're from.
Kenneth Krell, MD. I'm from Idaho Falls, Idaho.
Welcome.
Welcome. Thank you for this opportunity, Mr. Chairman. I won't speak to the dollar costs involved in Medicaid expansion. You're going to hear real experts talk about that. And I won't speak to the issue of mental health care, but that's a very important aspect of what Medicaid expansion will do. What I might be able to do, though, is to illuminate for you from a working stiff's perspective what the failure to expand Medicaid has done in the state to those of us who are in the trenches. I'm medical director of critical care at Eastern Idaho Regional in Idaho Falls, although I'm not speaking on anyone else's behalf. I see those patients on a nearly daily basis through the emergency room who present with end-stage disease because they've had no system to get care at a stage when their disease process might have been arrested. And they end up in my intensive care unit dying often because those disease processes are now at an end stage and have resulted in organ failure that's often results in death or really irreparable damage. Those patients who do survive critical care are left severely physically and emotionally and mentally damaged. How many lives failure to expand Medicaid costs a year has been an area of controversy. I've seen figures anywhere from 70 to 800 patients per year in the state of Idaho. I think the best statistics come from a study in New England Journal a couple of years ago that compared states who accepted Medicaid expansion with a neighboring state that did not. And in that study, it was found that the failure to expand Medicaid cost 19.7 lives per 100,000 population. If we extrapolate that data then to Idaho's population, that's about 324 lives a year. That is nearly one patient per day dies in this state as a result of not having Medicaid expansion. And that's a direct result of that failure to obtain care at a stage when the disease process could be treated effectively and not only death, but hospitalization and illness prevented. I'd like to illustrate that with a case, if I could, very quickly, and I don't mean to take your time, but Jenny Steinke was a patient of mine recently, and her family's given me permission to discuss her case. Jenny had asthma. She and her husband had always worked at minimum wage jobs, having no skills, but they'd always worked. Jenny's asthma had progressed to the point where she was using short-acting inhalers on an increasing basis, having gotten those from urgent care centers. And I might suggest that I don't believe that our good Governor Otter's program would have provided more than that. At any rate, Jenny's husband had noted that the weekend before on a camping trip, she'd been using her inhaler every hour. She went to work that Monday, the day I met her, and managed to get through the day but came home suffocating. She went to her neighbor's house, since her husband was still working, who packed her in a car and brought her to the emergency room. Unfortunately, on the way, Jenny arrested. The buildup of carbon dioxide and the lack of oxygen in her blood had resulted in her brain not getting oxygen, and she stopped breathing and her pulse stopped. In the emergency room, she was quickly intubated and resuscitated and achieved a pulse, and I met her about then. We had a very difficult time getting air in and out of Jenny's lungs, and I had to put her in a medically induced coma for 3 days while we got her lungs opened up. At the end of that, my worst fear came true when we were able to withdraw the medications and allow Jenny to wake up. Unfortunately, Jenny had suffered brain death. After discussing with the family and an organ donation, we withdrew support from Jenny. Jenny's case for me really crystallized what's wrong here. And I've kept asking myself, how could this be? How could, in a state like Idaho, where we care about each other, could I be seeing deaths and really damaging illness on a nearly daily basis as a result of failure to expand Medicaid that cost tangible lives? It's difficult to understand. It's been said that perhaps it's an ideological difference, that we just don't want to accept federal dollars. But if that were true, I don't think that we would see many in the legislature accepting federal dollars for federal farm subsidies. It's been said that maybe patients become dependent if we offer them Medicaid, but all of us have insurance, and it hasn't led to dependency on our part. I could only come to one inescapable conclusion, that the Idaho legislature is unfortunately responsible for those deaths. Our intransigence in failing to pass Medicaid for the last 3 years has probably resulted in over 1,000 deaths in this state, and I see those patients on a nearly daily basis. I would ask you to please consider extending Medicaid to those hardworking Idahoans who aren't asking for more than the rest of us get, which is health care and a place to get medical care. Please help us. I would ask you to please stop the killing. Thank you.
Thank you, Dr. Krell. Are there questions for Dr. Krell? I would remind all the members who testify before this committee not to make accusations of the Senate. That's very inappropriate, and I should have gavelled you down, but I didn't because I hadn't made that mention. But in the future, anyone who shows disrespect in this room will be dismissed. But thank you, Dr. Krell, for your testimony today. I'm going to allow Mayor Beater to come and testify. He also has a committee hearing, and then we will hear some folks on the other side of the issue. Welcome, Mayor Beater, to our committee.
Well, thank you, Mr. Chairman, members of the committee. I'm not a doctor. I have a Juris Doctorate. Please don't hold that against me, if you won't. It's pretty rare for me to come over and testify before you. I served in the House for 5 years. I understand the breadth and the number of issues that you all deal with, so I don't come running over on everything. But I think this is the most important public policy decision in the state of Idaho by far. And I appreciate the opportunity to say a few words about it. You know, I'm here because I see 3 gaps that concern me deeply because of their effect on our citizens and our future. The first is an obvious one. It's the gap that led to 78,000 of our citizens not being covered. And you know, it is a failure of our political system that led to that gap. But those 78,000 people really don't care how that happened. They only know that they are one bad diagnosis away from a catastrophe because they won't get the services or have the money to pay for those services. But that leads to another gap. And that gap is in economic activity. The good doctor talked about some of that, but you know, it's going to be, and it is beginning to already be, a chasm between those states that have extended Medicaid and those that haven't. Around 32 by our researches, states have taken the step, and 18, including Idaho, haven't. In addition to the more direct consequences that the U of I studied, the Kaiser Foundation, one of the best sources of information in the medical field, they're nonprofit, they're nonpartisan. Their estimate is over the next 10 years, $3 billion, it's billion with a B, of economic activity. And 11,000 jobs won't go on without the extension of Medicaid. Increasingly, as we all know, technology has made prosperity mobile. You can move a company, you can move jobs, you can move capital, you can move employees. It's my job as the mayor of Boise, and all our job as elected officials to make the best cities and state that we can, primarily for our citizens, but so we can be competitive in that increasingly competitive marketplace. I just say, without $3 billion of activity, our competitiveness is going to be compromised, and I think we all need to be concerned about that. But finally, it's the gap between what we believe, between our beliefs and our actions. We all come at this from all kinds of different places. But I think profoundly, every Idahoan believes when we see suffering, we have a moral obligation to do what we can to lessen or to eliminate that. Thousands of people suffer without this expansion, without this kind of coverage. This is an Idaho law. It's for Idahoans, it's by Idahoans. And we have the opportunity to address that suffering head on. And I think we all agree that when we see that, we need to take action to do it. I really appreciate the opportunity to testify. I know how hard this is. I know that, we try to do the best for our constituents across so many ranges of issues. And I can only give one other thing, and then I'll close. In the course of the time that I was here, and in the time since I've been there, I've had a lot of people say, well, if you do that, your political future will be over. 17 years into public office, that was wrong every time it was told to me. Sometimes it was threatened to me, and sometimes it was given as advice. This is something you can do now. I really urge you to pass this bill. And God bless you all for your service, and bless our state. And thank you so much for your time.
Thank you, Mayor, for taking time to come before the committee.
Thank you very much.
Is there a Laura Whalen in the room? Or if she's somewhere else in the building, she can come over? Or a Maggie Mon? Or Jerry Racco? Or Rainey LeBlanc?
Mr. Chairman, I think the list of testifiers was numbered 1 at the top, that people that made it into the room.
Well, unfortunately, Senator, the numbers have been scratched off. And so
It was the list with
there are no
Dr.
numbers on the sheets.
Is Dr. Krell on the top of a list?
Is Mike Brassey in the room? Mike Brassey, would you come forward and testify? Senator Nuxel, would you look through the sheets? And we want a representative group, but
Thank you, Mr. Chairman.
Mike Brassey, we know you, and you're free to have 3 minutes.
Thank you, Mr. Chairman. Mr. Chairman, members of the committee, I'm Mike Brassey. I am here today on behalf of St. Luke's Health System in support of Senate Bill 1205. As you will learn from people who have spent a good deal of time with this legislation, this is legislation that is designed to actually work for the state of Idaho. It was developed by healthcare professionals over an extended period of time, and I would urge the committee's support for the legislation because I think it is designed to actually be successful in operation. Mr. Chairman, I'll take up no more time of the committee than that, but I'd be happy to try and answer any questions from the committee.
Seeing none, thank you, Mr. Brassey. We appreciate your